Hello everybody. Today I want to talk about something that is important to me in my life, my thyroid cancer. I have been going through a lot of medication problems, high numbers, which I know a lot of people don't really know anything about, so we're going to have a small crash course in what your thyroid does. And a lot of people may not know everything that it does, but it does control a lot in your body. Um, this right here, and I know it's hard to see, is my double smiley face, my battle scar from my thyroid cancer. Here is my scar from where they cut into my neck and took out my thyroid because it was cancerous. Um, I'm not a doctor, obviously, so all the information that I be giving you, I either learned on my own, from my own self-experiences with this disease, or I read online, because you have to really educate yourself, especially when you're diagnosed with cancer. You need to be very proactive with your own health. Um, all right, so your thyroid. Butterfly-shaped gland that sits at the base of your neck. It's surrounded by, you have a lot of muscles and cords in your neck. It's surrounded by your vocal cords, so when they cut into your neck, it's very risky, because they could nick your vocal cords, and then you'll never sound the same again. I'm going to read off a piece of paper, so I wanted to write down. All right. What does your thyroid do? A lot of people think that your thyroid just regulates your metabolism and that's it. So suck it up, move on. No. Your thyroid regulates so much in your body. Not only does it regulate your metabolism, anybody with thyroid problems, weight gain, fatigue, depression, anxiety, high cholesterol, your thyroid really makes sure it's responsible for making sure that your body uses the energy correctly. If not working properly, your metabolism may burn energy rapidly, which is hyperthyroid, which when you see these really skinny women who can eat whatever they want when they want, they may have a thyroid problem called hyperthyroidism. Or your body, metabolism, your thyroid, may not be burning the energy fast enough. Hypothyroidism, which is where I'm currently at this moment, thanks to my medication issues. You could eat a bowl of salad and you're going to gain 10 pounds. You can go to the gym every day, you get massive amounts of cardio, you're still going to gain weight. You're not going to lose it. And it's very frustrating. Besides these things, fatigue. I can tell you personally, I'm tired all the time. I am exhausted. I would love to sleep night and day. It's extremely difficult to get things done sometimes when you're this tired. Weight gain. Sensitivity to hot and cold. I have a severe sensitivity to hot. I take my thyroid medication in the morning, and I am sweating my ass off in about an hour and a half. My body feels like it's a nuclear furnace. Rapid heart rate. Had that. You feel like you're running a marathon, but you didn't go anywhere. These are some of the small things. I won't say small so much. I mean, they're pretty big things. There's some other stuff that I know I've missed that your thyroid is responsible for. I am post-thyroidectomy 8 years, which thyroid cancer people know. Post-thyroidectomy means the complete and total removal of my thyroid, which was 8 years ago, and to this day I still have many issues. Right now I'm going to be having a barium swallow because I feel like there is something in my throat and I feel like I have to swallow over it to be able to swallow correctly. Also, at times, it's very painful when I try to swallow. It hurts. So, besides my endocrinologist, which manages my cancer care, and I feel is completely incompetent, I really don't like her, but I don't have a choice because I go to the VA in Albany and she is the only endocrinologist on that floor, and if I want to see anybody else I have to go all the way to Syracuse. So basically I have to suck it up and do what she says, even though at times I know it's not beneficial to my health. For the past, since June, I really noticed some issues, and I get my blood drawn every 6 weeks to find out where my levels are at, which with people with thyroid cancer, your main levels, your TSH, your free T4, and sometimes they also check your T3. Your TSH monitors your medication and where your levels are at. Hyperthyroid, hypothyroid. In June of 2013, my TSH level was high. It was 4.79. The normal level is 0.4 to 4.0, which I know it sounds like, okay, 4.79, really not that high. But for thyroid cancer people like me and a lot of other people, they keep us extremely, extremely low and usually want you at a 0.2. So I'm really high. We did a blood draw again in August, and at the time I upped my medication like she asked me to. My numbers doubled. They went from 4.79 to 8.30 in a month and a half. Once again, oh, we'll just up your medication. Okay, did it again. Another blood draw in October. My level went to 4.18. Still high for me. Upped my medication again. 350 micrograms I am taking of Levoxyl. I don't have my bottle right near me. I can't tell you the generic name of it. In June of 2013, my free T4 was 1.28. Normal levels are 0.7 to 1.5. So I'm a little bit within the normal range, but it's still kind of high for somebody who has no thyroid tissue supposedly left in their body. I'm waiting for my next blood draw. I just had it drawn 2 days ago to find out where my levels are at. And from there, hopefully, we're going to figure out what we're going to do, where I need to go, maybe change my medications. I mean, at this point, I don't really know anymore. But I'm going to continue to do everything I'm supposed to do, according to her. Take my medicines, go to the gym, eat healthy, but it's still extremely difficult. Being tired every day, doing the same thing day in and day out, medications, it's tiring. I'm really hoping that we figure out what's going on. I am willing to even do a full body cancer scan again to try to figure out maybe what's going on. My regular doctor at the VA has even said that the fact that I'm taking 350 micrograms of the medication is astronomically high. Even she said she doesn't treat people above like 200. And even she has said that my numbers, my TSH numbers, are high. They should have been fixed by now. she's at a loss too. But like I said, I'm limited to who I can see. So that's what's going on with my thyroid. And I'm doing this hoping that maybe you'll go to the doctor and you'll ask your doctor to run your thyroid levels, have them checked. Thyroid cancer is really missed a lot of the time unless you think that your throat's swollen or maybe you have some family history. They don't normally run tests for it unless there's an issue at that time. And the only reason that 8 years ago at the time that I got the ultrasound done was because I had family issues with past family medical history with thyroid, but they all had goiters, which is a whole other subject, but nobody was diagnosed with thyroid cancer. So I went to the doctors seeing if there was something wrong because one side of my neck felt bigger than the other. Turns out that we did the ultrasound and I just had muscle bigger on one side of the neck than the other, which is probably from me holding my phone constantly, going like this, working up that muscle, because big phone talker, long time ago. Now I could really care less to talk to anybody on the phone, not because I don't care about anybody, I'm just really I don't want to talk on the phone. We did that. He sent me to the endocrinologist, and she told me she wasn't worried. 95% of the population has thyroid nodules, and they turn out to be non-cancerous. So because of your size of the nodules, we'll do biopsy, see how it goes. But she reassured me again, she was not worried. 2 weeks later, I got a phone call from her telling me that the results were not what we had hoped for, and it was cancerous.